Okay, so I'm Dr. Mountford, and thank you for watching this video. A lot of my patients are curious as to how is it that I can put my hand on their back and know exactly where their pain is, where their problem is, without them even telling me anything about it. And how is it that I can know after an adjustment is done that the adjustment is actually done properly. And actually in my office I have a system where not only do I know that this is where the problem is and yes, we fixed it, but I also have a system where my patient also knows that yeah, that's the issue and yeah, I fixed it. There's actually 7 different tests that I have kind of gathered together over the years, some from other doctors, some from my own discovery, that have really brought me a lot of certainty that I'm very grateful for. So hopefully some other chiropractors might also be able to use this to bless their patients as well. But the 7 different things that I use, first of all, is warmth. I know that it's subjective, but it's also very reliable. Another one is palpation, in other words, feeling where the tenderness is and where the motion is. So there's tenderness and then there's also motion. One of the other ones I use is range of motion. When I do range of motions before and after an adjustment, the motion actually helps me to know where the issue is at and also make sure that it was addressed properly. It also gives me clues as far as how it needs to be adjusted. And then I use a special device called the rapid release device to check for nerve facilitation, and I'll demonstrate that in a minute, as well as some different special tests, and some strength tests. So, which is different than muscle tests. I don't do muscle tests, I do strength tests. So first of all, I'm just going to go ahead and show kind of warmth. When I put my hands on a person's back, just like a mother, when they put their hand on a child's forehead, you really can, once you get the hang of it, feel a difference in the warmth in the spine. And the reason why that's important is because if there's an area, by the way, this is my daughter Rebecca, so when there's an area that has an injury, which is what we're looking for, inflammation occurs in that area. Inflammation actually accompanies pain as well, which is why when I feel an area that's really warm, I know they're probably in a lot of pain. And when it's slightly warm, I know that it's probably just a little bit of pain, and maybe so little that they don't even realize it. So for her, for Rebecca, she's got a little bit of warmth here. It's probably not something that's very noticeable until I touch it. The other thing that I use is palpation. So I can use motion to determine if there's an area that's kind of stuck, and the area that's stuck is usually the one that kind of hurts. And then I can also use the contour of the spine. When I put my hand down the spine, in the mid-back, for instance, if there's these 2 bones sticking out called the spinous processes, and those are the bones that you feel on someone's back when you run your hand down their back. If there's a problem with the bone shifted out of normal alignment, or a vertebra is what we call it, that will cause a dip in the spine. And so as I run my hands down here, I can feel a little bit of a dip right there. And when I press on that, she kind of jumps, and I don't mean to be mean, but I want her to know where it's at. And when I press above it, not as tender, and not as tender below it. She's actually got a couple here in her mid-back. Some other things I can do, of course, is palpate for motion in the hips and such. So you get the idea. Another thing that we use is special tests. One of them is called, basically developed by a guy named Dr. Thornton, and he, just as kind of like a chiropractic geeky thing, he actually studied with Dr. Gonstead, who's just awesome. Dr. Gonstead developed the Gonstead technique. It's one of the main techniques I utilize in my office, specifically for X-ray marking, but also to understand how to adjust the vertebra properly. So with this test for the hips, it's an easy way to determine if there's a problem in the pelvis. I'll have Rebecca lift her whole leg off the table as high as she can. And this looks painful. I'm surprised she doesn't break in half. Do the other one. Do those feel the same on both sides, Rebecca?
Yes.
Okay. Most people can only lift their legs this way, but Rebecca is young and flexible, so good job. So this feels equal for her. If it was unequal, that means that there was a problem in the pelvis and these joints here. And I would use the x-rays to make an adjustment, and then we would do that test again to make sure that there was improvement. A strength test for the lower back is bend the knee, hold as strong as you can, and don't let me push it down. Okay. So she's got a really big muscle here. This hamstring should be able to resist this no problem, and she can't. And I felt an issue here in her lower back a little bit ago, and I already know from her x-rays and her history that she's got a problem right there. When there's a subluxation present, the most common form of that subluxation is going backwards in some direction. We call it posterior. And it can posteriorly shift with a lateral bending or a rotation of some kind, and there's lots of different combinations. But in her situation, I'm just going to go ahead and put my digital pressure to help that vertebra shift back into a better alignment, more into anteriorly, and I know that she doesn't have a problem with what we call an anteriority because I already took the x-rays. So there's no what we call a spondylolisthesis, which is a break of the back actually. So I don't have to worry about that. Bend your knee, hold strong as you can. Okay. Now that seems kind of voodoo, and I am very skeptical when it comes to stuff like that, but honestly, like, I have to tell you, this really works. It is so clear with someone that has a very significant injury with compression in their nerve in their lower back. I can take anyone with sciatica and they could come into my office and I will show them leg weakness. And when I find the spot and put the proper digital pressure on there, their leg strengthens up like that. They know it and I know it. Now, I might not be able to prove it to you in the video. You might just have to come in and find out for yourself. So the rapid release device, one of my favorites that I just discovered, so excited about this. In school, they talked about something called nerve facilitation, and if you can think about it kind of like getting choked. If someone choked you, you would not be happy. I would not be happy. You would want to scream and shout if you could. You'd want to fight them and resist. The same thing happens to the nerves. When there's a shift in the normal anatomy of the spine that houses the nervous system, so important for you to function, right? All that information comes from the brain, down the spinal cord, out those nerves. And if one of those nerves gets choked or gets pinched, the body is very upset about that. Does not like that whatsoever. So the muscles will spasm to try to fix it, and often you get increased sensitivity in a certain area or muscle spasming. And that is a sign of that beginning signs of the nerve getting pinched. When the nerve gets pinched more so, then it starts to travel down an arm or a leg, and it causes numbness and weakness. That's kind of like me getting choked so bad, or someone getting choked so bad that they're starting to pass out. That's when it's very, very serious. That's where I tell my patients, if you have numbness, my first job is to get it to pain. That's better than numbness. And I also, of course, there's other principles involved in showing the improvement. But this device right here, the rapid release device, it's a very comfortable, feels great. It's this little massager thing. It's actually not a massager. It breaks up scar tissue, and it's very specific. It's also very expensive. But this little device, as I roll up and down her back, will help me find those irritated nerves with what we call the nerve facilitation. And she'll feel it. And often I can already know where it's at because I've already done my assessment. And I'll just confirm with her because I'm not perfect, I'm human. I want to make sure I didn't miss anything. And that's the reason why we do several tests. So it looks like this. So I use the broad one. If I wanted to be kind of mean to Rebecca, I could use the one that's really pointed, and she'd probably spasm a little bit when I got into this area. Rebecca, is that where it was uncomfortable? Yeah. Is there any other spots that you felt it or no? Okay. So at this point, we would use the x-rays. And if you want to come over here to Rebecca's x-rays, I'll go ahead and shift this. There's a little divot in here, right where the problem was at. And I can do the adjustment, and then we can reassess with the different tools that we have to be able to see if that helped her. That's how we decide what to adjust, and we decide how to adjust it, and we know that we've done the proper adjustment.